In the United States, Black women are more likely to experience severe birth complications and are 3 to 4 times more likely to die from pregnancy-related deaths than white women. One underlying factor that contributes to this disparity is implicit bias. Welcome to Advancing Health, a podcast from the American Hospital Association. I'm Tom Hetterly, senior writer with AHA. In this podcast, we discuss the benefits of March of Dimes' Implicit Bias training program, titled Breaking Through Implicit Bias in Maternal Health Care. Joining Priya Bathija, Vice President of AHA's Strategic Initiatives, is Dr. Rahul Gupta, who was recently appointed Chief Medical and Health Officer, Senior Vice President, and Interim Chief Scientific Officer for March of Dimes, and Robyn Begley, AHA's Chief Nursing Officer and CEO of the American Organization for Nursing Leadership.
Thanks, Tom, and thank you, Robyn and Dr. Gupta, for being with us today. Today, we're going to talk about the March of Dimes new tool called Breaking Through Implicit Bias in Maternal Health Care. Building for a culture of equity within an organization is highly important, and this tool gives caregivers who are treating women the skills they need to recognize biases and implement strategies to mitigate racial bias in maternal care. Dr. Gupta, what was the impetus for creating this implicit bias training, and how can it benefit healthcare providers?
Well, first of all, thank you for having me, Priya. Thank you. The health equity has been at the core of March of Dimes' work for decades. Where we've championed for policies, we've funded research, we've served as a reliable source for families, and promoted greater awareness of the underlying causes that have contributed to our country's maternal and infant health crisis. Our goals have been ambitious and complex, yet achievable. We want to end preventable maternal health risks and deaths, as well as preterm birth and infant deaths. We can only do this by addressing and eliminating the health equity gap. So, implicit bias and stigma, coupled with institutional racism, we know is contributing to the disparities in maternal and infant health outcomes in our nation. So, we launched our implicit bias training for healthcare providers to uncover institutionalized racism in the healthcare system and train healthcare workers to understand better their own biases, because we believe to be human is to have bias. That's not the issue. The issue is to understand one's bias so that we address our own and do not further perpetuate the cycles of discrimination. This training, developed in collaboration with Quality Interactions, helps us improve patient-provider communications and make better treatment decisions, as well as the quality of care at a critical intervention point. So our training really provides three components. It provides an overview of the implicit bias and its impact on maternal infant health crisis. It provides background on the history of structural racism in the country. And it provides strategies for providers to both mitigate racial bias in maternity care, as well as commit to a culture of equity.
Great. So a number of the things you talked about, health equity, changing how people are thinking about those biases that, come just by being human, does require sort of a culture shift within an organization. So how do you think hospitals or other organizations that use this training can bring forth the change necessary to actually change their organization's culture?
Well, we believe that in light of the recent events, both for COVID-19 pandemic, as well as the amount of civil unrest sparked by the nation's deeply rooted racial and social inequity, we at the March of Dimes have paused and taken a step back to reflect on our core mission of tackling America's maternal and infant health crisis, which we know is particularly devastating for our underserved families of color. The statistics are staggering, and we feel strongly that we cannot stay silent if we want to make lasting and positive change for moms and babies. For instance, we know even during COVID-19, there's a disproportionate amount of Hispanics and Black people that are losing their lives and succumbing to the pandemic. We also know in the space of mom and babies that through a number of data points that if you're Black, you're much more likely to die, about 3 times more likely to die as a consequence of childbirth. You're also much more likely to give birth to an infant born with preterm. You're also much more likely to give birth to a preterm infant. We believe that this training can be the starting point for a larger conversation within your organization about structural racism and equity. It's time for all of us to take bold, immediate action to unequivocally dismantle structural racism and support policies and system changes that will lead to real and measurable improvements in health, as well as fair and just opportunities for health. So it's important that we must work together to give full access to healthcare for all moms and babies.
Thanks, Dr. Gupta. And Robyn, how important is this training from a hospital perspective?
Thanks for that question, Priya. And first, I'd like to say that it's an honor to be here with Dr. Gupta. And a little bit about me to the audience is that my career began in the maternal child health space. So this is a really critically important topic to me. And this training, boy, do I wish it existed when I started my career in labor and delivery a number of years ago. I really think it's critically important. Training allows hospitals to reevaluate their processes and structure through a health equity lens, which we know is a lens that we have not always utilized in the past. It brings forth discussion among team members that would not have occurred otherwise, and it encourages members to look at the data more closely. What are we doing wrong, and how can we be better at delivering care to women of all colors? Also helps us to better understand any implicit bias that we ourselves may have towards our team members. We can use this training to better equip ourselves in addressing the various needs of diverse patients. It is certainly not a one-size-fits-all situation.
Thanks, Robyn, and thank you for sharing your personal experience and background for why this issue is so important. Dr. Gupta referenced that this training is a starting point. So once our hospital members complete this training, what should they do next? And how do they actually use this training to help improve maternal health outcomes in their communities?
That's a great question, Priya. First of all, I think it's really important to talk about it. This training is not something that team members go through and tuck it away and never discuss with each other or with other members of the hospital-based team. We need to share the results with the board, with leadership, with all of the care team members, and we really need to be transparent and honest. It's only going to help us if we look at the issue straight on and address it to the best of our capability, and that's not always easy. We know that the data might make us uncomfortable, but that's okay. The first step is realizing that these biases exist and we can't continue to run away from that. We need to use what we've learned in the training to create processes and structures that are inclusive. For example, think about how your hospital or healthcare system can create a doula or a community health worker program. Or think of other groups that can benefit from this training and share it with them. We need to invite diverse voices to join the table when collecting community health needs assessment data from our community. We need to think about the systems that our hospital uses to track patient and provider interaction Or, ask the question, do we have an assessment of any type that will help us understand if patients are being heard and if their needs are being addressed? And this applies to during all stages of our patients' care, from, prenatal care all the way through postpartum. And we need to track that information. I think it's also important that we offer active listening training to all of our providers.
Thanks, Robyn. So I just want to end with one last question, and perhaps Robyn can answer first, and then we can hear from Dr. Gupta. But besides having all care team members take the implicit bias training that is being offered by the March of Dimes, what are some other ways that we can ensure inclusivity and address gaps in maternity care? Robyn?
Let's create a safe space. We don't want any voice to be unheard. We need to listen and encourage moms to voice their concerns and be part of the conversation. We need to empower our mothers to advocate for themselves. And we also need to empower our family members to advocate for their loved ones. We need to dig deep into the data and understand the disparities that women of color are facing in our communities. We need to look at race, ethnicity, zip codes, the information that we have at hand, and we can't be afraid of what we may find. Data will be key in making a difference in the way we deliver care. It's really important that we build connections, whether it's establishing doula and community health worker programs to support women or investing in technology to better connect patients with their providers. Building connections builds trust. Research these ideas and find community partners to support you. Also important is addressing racism as a social determinant of health. Racism is a key driver of the disparities faced by many communities of color. Hospitals must acknowledge it as a societal factor to understand why these health disparities exist. We have to start integrating it as a strategic priority. We need to closely monitor racially diverse pregnant women with underlying risk factors and use data from employee and patient satisfaction rates to identify inclusivity or discrimination in our workforce culture.
Thanks, Robyn. And Dr. Gupta, any other suggestions for how we can ensure inclusivity and address gaps in maternity care?
Yeah, I think, Priya, that's an important piece to recognize that implicit bias are one of the first steps, but not the only steps. It's very important as we move forward to address the challenges that we face and recognize that this pandemic is only unsheathing the tremendous amount of disparities that already existed within our communities. It's also important to take into account that there will be a lot more work that will be needed to be done in order to address the structural racism, as well as those elements within our social determinants of health, meaning within our communities that we need to address. But it can help to have a broader discussion. We know that having a diverse workforce is so critical because not only it is the idea and the notion of having diversity, but it's actually the idea of having a different and diverse levels of thoughts and ideas and innovation that helps our employers actually do better in their performance. So it starts out from implicit bias, but we must not stop there. We must think about what are the other changes we can do within our organizations positively to seek and achieve equity amongst everything we do. It's very important. It's similarly important as my colleague Robyn mentioned in making sure that we're working across communities and within communities to figure out what do people who are pregnant want and need. It's very important to have a healthcare system that's centered around the person rather than centered around itself. So as part of that, it's important for us to go back and look at those challenges within communities to figure out how do we help drive both economic, social, and health equity. by focusing on prevention, focusing on treatment, and focusing on those structural changes within communities that would help eliminate racial and ethnic health disparities, improving access to care, figuring out how to expand critical health programs, closing the gaps in coverage, finding the doulas to assist in the care. This is a wonderful time, as Robyn has mentioned, to look at culturally competent workforce that looks like the people we're trying to serve. And then to address those preventable health conditions through expanding in research and improving maternal data collection, as has been mentioned. So there's a number of things we can do. I think this is the beginning, and I think it's a good beginning to start and continue to address the challenges that we face today in maternal and infant health crisis world.
Thanks, Dr. Gupta. And, both you and Robyn recognize the need for us to work across communities and to build connections and collaborate. And I just want to thank you, Dr. Gupta, for the opportunity for AHA to collaborate with March of Dimes on sharing this implicit bias tool with all of our hospital and health system members. We're really excited to be able to present this as an option to them to begin addressing implicit bias and to really take that first step. As we all have discussed today. So Dr. Gupta, Robyn, thank you so much for being with us today on this podcast and to share more about this implicit bias tool, but also other steps that hospitals and health systems and our healthcare leaders can be taking to improve maternal and child health outcomes. So thank you again, and back to you, Tom.
To access March of Dimes implicit bias training, visit www.marchofdimes.org.